So I'm able to populate all my information in that appointment style right from here. Notice how the status is checked in there, so it gives me the check-in status. I can update the visit. There's also options here for going to billing information, eCliniforms if I need to get certain items, as far as forms or image information that need to be annotated, Messenger, go to their hub, even lock progress notes. On the top, if you want to filter by specific providers or facilities, you can do that and just click filter. And we also do have our option here for filter defaults. And then all the way to the right is our gearbox. This just allows you to select which fields you like to see. Then nurses workflow here, when I go into my patients, they can see patients that far as assigned to for providers. So if they want to go ahead and see that information there, they can navigate. Or, of course, they're just going to be able to go to the waiting room. And then based on the waiting room here, they can see the whole active list. This allows them to see all appointments that are on the schedule for today, regardless of, of course, status. So this is just showing me the waiting room, but they can go to active list and they can click on it and they can see everybody. So able to navigate to waiting room, they can go to my patients, see by provider, but active list is available there for them to see all appointments for today. Anyone who's in triage, arrive, pending, gives them a good bird's eye view. So the visit status, of course, allowing them to see what stage in the appointment they're in. Time in status, this is considered the cycle time. So where we can see timer reset any that status has changed. However, in the time in clinic, it's going to be preserved through the whole process. So that's, of course, in the clinic, but the time in status is going to be it's always going to be changing. And in the room number, we can place the patient in a room. So let's say here, like Maddie, I'm going to click on it and hit room 3. Okay. And then if I click here on the patient's name, I can launch the progress note. The nurse will now document vitals and enter in information as needed. So let's say the nurse here, he's putting in information. Let's put in here. There you go. Let's take pop-up out. This will be a little quicker for me. And I'm going to pay 135 bucks. Okay, so I just put in my vitals here. Close that out. So now I see my information right here. Out of range vitals will display on the tracking board as well, allowing nurses or providers to be able to view them before even having to access the appointment. So if I go back here to my tracking board, and go to my active list, and then notice it does highlight that there for me in red. And now I can update the status here as well. So if the provider is ready now, let's say here, where'd it go? Ready for provider. Did have one here. Oh, let me just refresh this. Should have it there. All right. So I'll set it to that one, and I'll go ahead and specify. Okay. So I'm just going to use that one for right now. I think I can't find my other one here, but I was playing around with it a little bit earlier last week, so I might have just kind of removed it. But I have my option here, and then I'll select that status there, of course. Now, from My Patients tab, remember My Patients tab, as I mentioned earlier, this is based on our provider information. So the tab is only visible if the logged in user is a provider. If they're not a provider, they're not going to see this tab. So it will only show the patients that are assigned to the logged in provider. Okay. Now the provider will update the status. Now Maddie was not assigned to this provider that I'm logged in with, so I just wanted to show you that. That's not sitting there. So that's why I'm not seeing the updates here, because Maddie is assigned to a different provider in the system. Now let's just say here we have the information. The provider will update the status or the room number information as needed, so they can go here, update the, say maybe a provider here, indicate any additional rooms information. They can again click on the patient's name to go ahead and see additional details here. So I can go in now, click on the progress note, click on the name to launch the progress note. I can place orders here, labs, DI, procedures, medications, immunizations, referral information, all from here. Okay, so I'll be able to see those details. And just give me a second here. I'll actually move one here just so that way we can see it. And I'm just going to change provider roles here for Maddie so that it's a little easier. So I'll go here. Give me 1 second here. All right, so let's just go here and put one for the logged in provider so we can see that. So I'll just go here. I'll select Maddie again here. And then we'll put in a type here. Yep, we'll say that's fine. So now if I go back in, again, I can go see my waiting room information, and I'm just going to actually just put in with MD here, so that way it populates here my patients. Okay, now let's click in here, we'll open it up, and we'll add in some information here. So let's just go here, we can go treatment, we can add in some lab information. So let's put in like hemoglobin here. And then we'll also put in a urinalysis. Okay. I'll click close here. I just put in my lab there. Also put in, let's do procedure. And we'll add up medication here as well. I'll drop that in. I'll click OK. All right, so I just have my information. And then now I'll also add in, let me just put an immunization here as well. So let's go here, immunization. I'll put in my influenza. All right, so now I have some information here. Now I'm going to return back to the tracking board. Go to my S letter here, just go tracking board. So I'm going to see some additional alert tabs options now sitting here. So now notice that these are popping up. Okay, so this shows all orders that have been made. The number indicates how many of each. So I can see here 2 labs. I see my procedure, medication, and immunization. I could have one here for my diagnostic imaging. I did not put a diagnostic imaging there. Or I would see like a little X-ray kind of looking icon. That I just want to show that that's blank here because I don't actually have one in there. Okay. The number indicates how many of each. The triangle that appears on the upper right corner, upper left corner, indicates that it's in-house. So if there's a little triangle here, I don't think I have one in here. Yep. So if it's in the top left corner, it's going to indicate that it's in-house, if I do have that in there. And the status key color is coded and displayed at the bottom of the tracking board. Also, there is more than one order per type. So 2 lab orders will display the status of the most incomplete one. So for example, the urinalysis result are received, but the hemoglobin hasn't been processed into any other status. Status on the alerts does remain grade overall. So the ordered, it basically just stays in the ordered status. In the future version, we are looking to break it down by each individual statuses. Okay, and if you click here, you can see your patient orders. Now, we can discharge the patient by selecting the patient here. And I have my option to discharge. Say yes. All right, now if I go to my discharge list, all the patients that have been discharged will be removed from my patients, and all active list will only be visible in this discharge list. The status will automatically go to checkout. Now the send button here I can click on it. It'll open to the common send window where you can quickly send all orders as well as provide patient visit summary education to the patient. So you can see my orders. And then for patients, I also see my information right there. Okay. And discharging the patient does not lock the progress note. So just know that it doesn't lock the progress notes. Providers would still follow their regular procedures and lock their encounters. Okay, so just discharging isn't going to the complete note. Right. Now, lastly here, let me go to my.eclinicalworks.com. I wanted to go back into the support portal, and I want to show you some additional details here with urgent care. So let me just jump back into here. If it lets me log back in, let's try this. All right. So right here, I'm from my.eclinicalworks.com. I can go into knowledge, documents and videos. Just type in urgent care, and you're going to be able to see additional videos that we have built as well. So it's going to give you some more information and break it down here. We have our urgent care options here with EMR and tracking board information. So you'll be able to go ahead and click on any of these videos to take a look at them and view them at your own convenience. And there is also a user guide available there as well. All right. So with that being said, that does cover items here for our Urgent Care.